The Self-Sufficiency Research Clearinghouse. I want to welcome you all to this webinar today. The implications of public programs as maternity leave among single-parent mothers. I'm going to do a little overview of the SSRC Research Clearinghouse first. It is a virtual portal of research and other resources related to self-sufficiency. It functions as an online community for researchers, practitioners, and other stakeholders interested in self-sufficiency, employment, and child and family well-being. And I'm Kristen Moore on the SSRC team. I'll give you a little more background. The purpose of the SSRC is to disseminate quality research. We currently have over 4,400 items in our library, and we're constantly adding new resources. The library's materials are organized into 12 topical areas that are listed on the right-hand side of your screen. Please forward to that. Every topic area under the, every item included in library is reviewed for its relevancy, and users may search by keyword or use filters like topic area, target population, geographic location, or research methodology to browse for collection. Every topic area under the Browse Topics tab includes an Our Librarian Recommends box that highlights research and resources that are recommended by the SSRC library team. Each topical area page also includes relevant federal laws and regulations. In the next slide, under the Stay Connected tab, you'll find entities involved in self-sufficiency research, a robust events calendar, and a list of organizations that have partnered with the SSRC to host events. Please visit this tab to access previous webinar recordings and additional materials. On the screen is a snapshot of the new Students Corner and Professor's Place. Through these tabs, professors may access self-sufficiency-related course material and reading, and students may parse through SSRC library resources to supplement their coursework, as well as explore learning opportunities within the self-sufficiency field. Finally, the SSRC houses a number of data sets and sources to support program management and facilitate improved outcomes for children, families, and communities. On the right side of your screen, you'll find links to various features of the SSRC. Select the title and then click the Browse To button for those links to open in a new window. The emerging scholars are chosen for a variety of criteria. They are a graduate student or a degree recipient, but someone with no more than 10 years of experience working in the field, who is currently doing research on some self-sufficiency issue related to those 12 SSRC topic areas that we showed. And we're interested in having scholars who are in academic settings, but also program settings, think tanks, or agencies at the federal, state, or local level. And we've had a number of emerging scholars, as shown on this next slide. So we're going to move today to our speaker slide. And we are very pleased to have Marcy Ibarra, who is an assistant professor at the School of Social Service Administration at the University of Chicago. And our discussant today is Margaret Sims, who is a fellow at the Urban Institute. And as I said, I'm Kristen Anderson Moore, senior scholar at Child Trends, and I will be the moderator. At this point, I'd like to turn the mic over to Marcy.
Well, thank you so much, Chris, for the lovely introduction. I'm really excited today to be here for the webinar to talk about the implications of public programs as maternity leave among poor single mothers. I think the way I think about this for a research area is that there's a burgeoning line of interest about family-friendly work policies that's often talked about in the context of supporting all families. And through this line of research that I have along with other collaborators, what we're finding in general is that we probably need to pay a little bit more attention on the research and advocacy side to mothers who are poor and single post-birth and what their economic resources look like for a variety of reasons that I'll talk about in today's presentation. Just to offer an introduction, we know that women make up almost half of the workforce, and that's up since 1970 from 38%. We also know that mothers with children of all ages are working more than ever before. And this is part of the reason there's been this burgeoning interest in work-family policies. And when I say work-family policies, I'm talking about policies that fall under the umbrella of some kind of time off. Some of that might be unpaid, but I think most researchers, scholars, and practitioners are thinking more in the lines of paid work-family friendly policies. So you can think of things like paid family leave, which I'll talk about a little bit in this presentation, but also things like paid sick days that not everyone has access to. I moved ahead too much. So just so we have a sense of how much mothers' work participation has increased over time, I mentioned before that all mothers' work participation increased when they have children, irregardless of the child's age, but there have been differences relative to age, and it's not a tough story to imagine why. If parents have a teenager who's in school full-time, arranging work and family around that schedule looks very different than parents who have a toddler who's likely in daycare. And so we see that from this chart from the Bureau of Labor Statistics showing mothers' work patterns from 1976 to 2012 relative to whether the age of their child, the youngest category being having a child under 3 years of age. So those with the youngest child are working less, but the increase has looked similar over time. And as you would expect, mothers with older children are working more, but also the patterns of increases have been pretty similar across moms with children of certain ages. So what share of mothers are currently working today? Well, if we just think about all moms with kids who are under 18 years of age, it's about 17%. But when we look at it by age, in the prior slide, it only looked at children under the age of 3. And for issues of paid family leave and maternity leave, it's really important to consider the work patterns of moms who have infants, of course. And so down below what we see is that, again, work participation decreases by the age of a child. But even among mothers with infants on the left hand of the screen, we see that 57% are working in the year post-birth. So a majority of mothers with babies are returning to work. So we know that a majority of mothers are working, and we know that even including mothers with really young children and infants, they are working. What's also important are, in addition to the changing work participation rates of mothers, are the parallel changes in U.S. family structure. And so by that, I mean more births to unwed mothers. And so from a research perspective and from a policy perspective, there's concern that single mothers, we know, are working more as single women who don't have children. And what does that mean for them in terms of arranging work and family? And more specifically, what does that mean for them around the time of a birth in arranging work and family? As I mentioned before, the change in the family structure in the U.S. it also means more single mothers, and that's great cause for concern. But what's mediating this are also changes in the U.S. policy system. And namely, I'm talking about the welfare reform of the 1990s. Because reform, which was a broad set of packages that made means-tested support or welfare programs contingent on work in exchange for benefit receipt. And so what that meant was that there were more single mothers entering the labor market for a couple of reasons, two important ones. In the mid-1990s being this pretty good economy that allowed for getting a job to be relatively easier than it was in, say, the Great Recession, so also contributing to more single mothers being in the labor market. We know that a majority of mothers, all mothers, especially those with infants, are working very soon post-birth. At the same time, we also know that compared to other industrialized nations, the U.S. has a patchwork system of maternity leave for all mothers. And I'll talk a little bit about how across 3 different sectors, it actually remains a patchwork for all families. When we think about families, we tend to think about 2 types. two-parent families and single-parent families. And among two-parent families, there's no question that putting together maternity leave and arranging, child care and bonding during that first year of life is also a challenge. However, we know that two-parent families oftentimes have more formal sources of support, typically coming from the wages of the other parent in the home that typically doesn't cease when the parent, usually the mother, takes time off of work. And they also likely have more access to informal resources. So just having a stable relationship with another person in the household through marriage, we know that person is more likely to contribute not only financially, but also in the caregiving responsibilities of the baby in that first year of life. So we would expect both formal and informal resources to be on average higher for two-parent families. When we think about single low-income moms, we think that they may be at a distinct disadvantage during the post-birth period because they're probably less likely on average to have access to really important informal and formal resources. So if you're a single mother without a partner in the home, you likely don't have access to another set of wages that might buffer against some economic insecurity in the year post-birth. And there's also questions about what kinds of informal resources of support that they would have readily at hand without a partner in the home. Of course, they could have extended family, but lots of folks would argue that's not the same as having someone in the home with you in a stable relationship like a marriage. So what do we actually have in the U.S. for maternity leave? As I mentioned before, it's a patchwork system, which is uncommon in industrialized nations. We now are the only industrialized nation that does not have a formal federal level paid family leave or maternity leave program in place. The patchwork system is comprised of three different types that I'll focus on two, but I'll mention the three. The first one is the private sector, and by private sector I mean employment through the private labor market. And even within employer-provided leave, it's often a patchwork of employer-provided policies. So some employers might offer formal maternity leave, some employers might offer a short-term disability program that covers childbirth. It's known that parents also might rely on paid sick days they've saved up. They may use vacation days around the birth of a child, and they may even use personal time paid off. In most instances, employees who are having children are using a combination of these different sets of policies if they have access to them. When I refer to public sector supports, I'm talking about three different types of programs. The first one being the Family Medical Leave Act of 1993. This is a provision that provides 12 weeks of unpaid leave with job protection, which is a really important feature of the policy. So it's designed for caregiving responsibilities of many different types, but it's most often used for maternity leaves from work. It is dependent, if you qualify for Family Medical Leave Act, you have to meet a certain number of hours worked in the past year, and you also have to work at a firm that has at least 50 employees or more. And so what this means is that low-wage workers are, by and large, significantly less likely to be covered. In fact, it's about only half of low-wage workers that are covered by the Family Medical Leave Act and, in turn, have some job protection. The second program is temporary disability insurance, currently offered in 5 states, California, Hawaii, Rhode Island, New Jersey, and New York. And I'll refer to temporary disability insurance for the rest of this presentation as TDI. TDI is essentially a wage replacement insurance and social insurance program for a disability, including disability for a childbirth. You typically receive 4 to 8 weeks around the time of a birth, but it does not offer job protection. The third program is a more recent program, which would be paid family leave programs that certain states have decided to implement. Currently, 4 states have implemented or are in the midst of implementing paid family leave programs, which would be California, New Jersey, New York, and Rhode Island. Washington State has passed a paid family leave policy program in 2008, but they haven't yet implemented it due to ongoing budget concerns. This is also a wage replacement program. You get a certain percentage of your wages when you benefits. And only the Rhode Island Paid Family Leave Program, which is actually the newest program, offers job protection. When I talk about means-tested support, I'm by and large referring to the Temporary Assistance for Needy Families, also referred to as cash welfare. And we know from an emerging line of scholarship that means-tested programs, the implementation of welfare reform has led to an increased labor market among single low-income mothers. So the concerns arising from this, from researchers and from policymakers, if single low-income mothers are disadvantaged around the time of a birth and less likely to have access to public and means-tested support, what resources might be best in supporting low-income mothers during this time? Very little information on how low-income single mothers are actually making ends meet around the time of the birth, even though we know that they are far less likely to have access to employer-provided leave, public sector leave, and we don't really know how much they're accessing means-tested support. Finally, I want to know, what impact do different types of support have on employment for single low-income new mothers? So on the one hand, we can think about this, these questions being driven by near and long-term economic family well-being. So if a mother is out of the labor market for too long after a birth, then we might be concerned that that can lead to, wage decreases, or it would dampen economic mobility over time, due to being out of the labor market during around the birth of a child. The second concern, and this can be conflicting, are concerns about maternal and child health. We know from prior research that the length of time mothers are off of work post-birth is associated with things that we know lead to healthy development for children, such as breastfeeding. Moms who are off longer tend to breastfeed longer. Moms who are off longer tend to have better rates of child immunization, so things of that nature. So today's presentation is going to try and get at some of these questions to offer a more nuanced picture of what challenges single low-income mothers might face for maternity leave and what some of those outcomes might be. So the first study is the implications of paid family leave for welfare participants, where I'm looking at what it looks like to substitute paid family leave provisions for a monthly welfare benefit and whether moms are actually better off. The second paper tries to get more at how mothers are faring economically in the year post-birth. We're examining material hardship among single low-income mothers who had given birth in the year post-birth. And then the third study tries to get at what some of the economic concerns might be for moms taking certain periods of time off in the labor market after post-birth. So I'm looking at returns to employment by less educated mothers. And less education is simply a proxy for lower income mothers because we didn't have that variable to measure. And I'll talk a little bit more about that for each presentation. Okay, so the first study, would poor single mothers receive more resources from welfare or from paid family leave? So I'm just going to take a little bit of time to talk about the data that was used. I did my dissertation at the University of Wisconsin, and so this is part of my dissertation that turned into a paper. I drew on administrative case records from the Assistance for Needy Families, so the TANF program, Wisconsin's cash welfare program, for a cohort of moms who recently gave birth and entered Wisconsin's welfare program in the fall of 2006. So the sample size is about 293 mothers. For methods, I simulated the benefits from 3 different state-level paid family leave programs. At that time, California, New Jersey, Washington. So I essentially used their rules around how much you had to earn to qualify to get into the program, what their wage replacement actually was, and then the length of time that you could receive benefits. And I compared that to 3 months of benefits from Wisconsin's TANF program. So in general, our sample for this study looked very similar to what Wisconsin's welfare population looks like. 60% were 21 years or older. It was overwhelmingly an African-American sample, mostly less educated, being 59% had less than a high school diploma. And 49% actually entered the TANF program with their very first child. So almost half of our sample in this study were first-time mothers. 95% had been single and never married. And as far as the work participation patterns prior to entering TANF, over half of them had worked in all 4 quarters in the year prior, which we define as a consistent worker, somebody who worked all year round. And if they hadn't worked all year round, about 80% of the sample had worked at least a few quarters or 2 quarters out of the year prior to birth. So overwhelmingly a working mother sample. And we know that among the consistent workers, the ones who were working a lot prior to giving birth, 80% actually returned to work within 3 months of entering TANF. So really giving us a sense that these mothers were using welfare, Wisconsin's welfare system is essentially a means-tested paid family leave program. So I just wanted to briefly go over some of the dimensions of the 3 programs I used and how it compares to Wisconsin's welfare program in terms of the rules and requirements, to give us a sense of why someone might be better off with a paid family leave program, or they might actually be better off with welfare in Wisconsin. Focusing on the pre-benefit annual earnings requirement, you see that in California, the requirement is actually fairly low. And so what that means from a take-up perspective is you should have a lot of single mothers who are working qualified, because you only need $300 in the year prior to entry. We see in New Jersey and Washington, it's $7,000 and then about $5,500. And so you're going to have less families actually qualifying because the earnings requirements are a lot tougher to meet, actually. In Wisconsin, we see $16,000, but that's actually the cutoff rate. So you can't earn more than $16,000 to enter Wisconsin's welfare system. Wage replacement rates, also dissimilar, 55% wage replacement rate in California, 66% in New Jersey. Washington has a flat rate of $50. In Wisconsin, they don't give you less or more based on your household size. It's simply a flat. There's maximum weekly benefit caps, California being the most generous, New Jersey being around $500, and then Washington and Wisconsin falling in the $200 and $100. And then the other things that aren't as important to our sample because they're not going to cap out on weekly benefits by and large for these other programs. There's some diversity in the cap. Benefit durations across the paid family leave programs are very similar, 6 weeks in California and New Jersey, 5 weeks in Washington. But in Wisconsin's welfare program, the work exemption is actually 12 weeks long. It mirrors FMLA, Family Medical and Leave Act exemption. And you can see from this that there's actually no job protection across any of these provisions, including welfare or paid family leave. So this is a chart that shows simulation of paid family leave eligibility and what moms from my sample in Wisconsin would receive in average weekly benefits from 3 different paid family leave programs versus what they would have gotten from Wisconsin's TANF weekly benefit of $168 a week. So on the left side of the screen is California's paid family leave simulation. And what isn't surprising is that only about 24.5% don't qualify. Remember, they have a very requirement of $300. Among those who do qualify, we see that almost 44% would actually be worse off. Partially because of their wage replacement model. And about 32% would actually be better off receiving California paid family leave rather than Wisconsin's TANF program. When we move over to the middle to the New Jersey paid family leave program, remember their earnings requirements were much higher at about a little over $7,000. So about 58% of our sample would not even qualify for New Jersey's paid family leave program. And among those who did, about 18% would receive fewer resources in New Jersey's program, and about 24% would actually do as well or be better off with their program. And these are largely comprised of the most consistent workers and the highest earners that were using Wisconsin's welfare system. So the Washington paid family leave program, it's pretty much an equal split. Remember, Washington had a little bit of a lower earnings requirement than New Jersey. It was about $5,500, and it was also a flat rate model where if you qualify, you get $250 a week irrespective of what your earnings were. So lots of variation in what moms would receive. By and large, what we know are that mothers with infants who enter TANF are working mothers for the most part. Most are returning to work after the TANF work exemption expires. And compared to paid family leave programs, most would receive more from TANF. And there's a really important caveat to this. This study was done in Wisconsin. Wisconsin's TANF benefit is in the top quartile of states. And so it's a really generous, at least in monthly benefit rates program. So if I did the same simulation for a low benefit state, we'll say Mississippi, then it's likely that those moms actually would in their outcomes for who would be better or worse off considering paid family leave versus welfare. Okay, so the second study, we're trying to understand whether public programs do a job or have an impact on material hardship around the time of a birth. This is getting back at how are mothers faring in that year after birth, should we be concerned? And for this study, the data is drawn from the Survey of Income and Public Program Participation, which I'll refer to as the SIP. It is a panel-based study that collects demographic information as well as welfare participation by month and material hardship measures in a module, such as essential expenses, payment of rent and utilities, and difficulty paying any of those. We're using data from 1996 to 2008 from the SIP. We're also incorporating TANF rules from the Urban Institute's welfare rules database. The policy rules that we use coincide in the same years that we're using for SIP, so 1996 to 2008. And we're trying to understand if TANF, some of the TANF rules impact material hardship. So things like the length of an exemption for a mom with a baby, the maximum benefit the state offers for a family of 3, whether or not eligibility for pregnant women is allowable, if the state imposes a full family sanction, which is actually trying to get at how the severity of punitive measures, the maximum earnings allowed for a family to participate, and then what we refer to as hassle factors, which is essentially a measure that tries to capture how tough is it to get into the welfare program. And the way we measured that was using policy rules like, what kind of documentation do you have to apply? Is there an application period? Things of that nature that you would think might hamper someone's ability to get into their state-level TANF program. And then we also include state-level information on whether or not a state has a paid family leave or TDI program in place in a given year, and also unemployment rates for a given state. We use 3 logistic regressions on each material hardship measure and control for the variables I just mentioned. Our samples comprised of all mothers who had a birth recorded during the SIP samples that they participated in, and all of those mothers were at or below 200% of the federal poverty line in the year prior to birth. We have a sample size of 1,174. So what's the experience of material hardship among single low-income mothers in the year post-birth? So here we see, first of all, a non-trivial share across all 3 measures. The highest percentage of material hardship experienced by single low-income mothers in the year post-birth are difficulty meeting essential expenses. And then reports on difficulty paying a mortgage or rent is about 20% of the sample. And then difficulty paying a utility bill in the year post-birth, about 1/3 of the sample. When we consider, when we add in our control variables and run logistic regressions on each of the material hardship measures, what we found was that, and we were most interested in the policy effects, so this idea that policy might be able to alleviate some of the material hardship experience post-birth, and we see for essential expenses that living in a state with a temporary disability and insurance program significantly decreases the likelihood of reporting you have challenges meeting essential expenses in the year post-birth. And the TANF work exemption length is also modestly significant. So the longer the TANF work exemption is in your state, the less likely you are to report trouble paying essential expenses in the year post-birth. Next, we looked at difficulty in paying rent or mortgage. And again, temporary disability insurance figures in prominently. If you reside in a state with TDI, you're less likely to report difficulty in paying rent or a mortgage. And in this instance, the TANF maximum benefit in a state, the higher it is associated with a modest decrease in the likelihood of you reporting. You had difficulty paying rent or mortgage. And when we look at difficulty paying utilities in the year post-birth, again, TDI figures in. If there's a TDI program in your state, you're less likely to report difficulty paying utilities. But we also see both lengths of a TANF work exemption and maximum earnings for TANF families are significantly associated with decreases in paying, reports of decreasing paying utilities. And for this instance, this is the first material hardship measure we find where hassle factors are also important. The less difficult it is to enter a welfare program in your state, the less you are to report difficulty paying utilities in the year post-birth. So what we know from study 2 is there's a non-trivial share of single low-income moms who experience material hardship in the year post-birth. We should be very concerned about this, given child and mother's development and also economic concerns. We know the temporary disability insurance program has a modest relationship, but promising with material hardship. We didn't find very many effects for paid family leave, and I'll talk a little bit about at the end of the webinar about why that might be the case. And TANF policies seem to be most important for utility hardships, which is also something that's important to keep in mind. So the final study is getting at the economic side of maternity leave among single poor mothers. And in this study we used less education as a proxy because we didn't have a variable for poverty. So does public program use during maternity leave shape returns to work? We're again using the SIP, but we're using their fertility module. It's important to note that the fertility module is unique and that it's collected every 4 years, so one time during the panel that you're in. And it's asking women about their first birth. So if you're in the 2000 panels, the we include state-level information on Medicaid, both in the years for the fertility module, which is 1998 to 2012. We also have state-level information on TANF rules, state-level information on child care subsidy rules, namely child care subsidy spending in each state. Again, we use a logistic regression on the probability of returning to work post-birth for less educated mothers. Again, we're controlling for demographic characteristics, age, race, education, and marital status. These were all measures that occurred at the time of the first birth. So mother's age, race, education, and marital status when she gave birth to her first child. And other state policies, namely temporary disability insurance and paid family leave. So it's a sample of first-time births in the SIP fertility module. We have a sample size of 7,972. We're looking at births and policies from 1998 to 2012. Our sample looks a little different than our other SIP sample because it's we're not drawing out of the main files from SIP. So this is a sample where it's between 18 and 30 years old, 50% more, and 70% are actually married. And so when we ran our regression on returns to work in the year post-birth, what we essentially found after controlling for demographic characteristics and other policies, that Medicaid seemed to be the only policy at this point that had any kind of significant relationship, and it was actually negatively associated with not returning to work. So put in another way, the more generous a Medicaid program was in the state, the more likely mom might be to not return to work in that year post-birth. Controlling for all demographic characteristics and all policy variables, the most likely predictor of returning to work post-birth was being unmarried. And we know from prior literature that, and from what was presented today, that unmarried mothers, single mothers, are less likely to have access to supports for maternity leave across a host of sectors. And it's likely they're returning to work out of need necessarily than out of desire to return to work so early. So aside from Medicaid, we actually found little evidence with the study that public or means-tested programs impact returns to employment. We know that single mothers, however, are significantly more likely to return to employment, all else equal. I want to remind people that results for this particular study are very preliminary in nature, and we're actually in the process of finally going through and trying to more rigorously measure our policy variables to ensure that we're not just mismeasuring and getting those results. So what can we take away from these 3 studies, and what are maybe some of the limitations of them? Women who have greater labor force attachment pre-birth also do post-birth, and this is across all 3 studies. Labor force attachment before having a child is a large predictor of when you return to work and if you remain employed. What I didn't talk about and have the time to talk about was how the changing nature of work could be important for future outcomes. And namely, I'm talking about the changing nature of work for low-wage workers. So really important areas of research right now that are getting a lot of attention is this rise in part-time employment, rise in fluctuating hours, and this is occurring in the midst of the U.S. having a patchwork system of paid leave in both the private, public, and means-tested sector. So understanding how the changing nature of work may or may not exacerbate the outcomes that we have right now, I think will be really important to the future. Clearly, policies play some role in resources and material hardship and employment post-birth, but I think that we have to be a little careful about this in the sense of why it might not be the case that they aren't playing a bigger role as maybe we would have expected. So one example of that would be why TANF or the welfare system didn't play as big a role in reducing material hardship or returns to work or things of that nature that we looked at. And one very pragmatic reason may be because that TANF program has shrunk dramatically over time. So it may be that because it's used so little, right, it's not having the impact you would expect if it were perhaps a larger program or a program that was easier to access. I think taken together, the studies clearly give a much more complicated picture of maternity leave for single-poor mothers, and it's an area that if we are concerned about single-poor mothers' economic well-being and maternal and child health for those mothers, then it's an area that certainly deserves more research interest, but also more policy interest. One caveat, all of these studies in some way, as most studies are, were limited by data. Some of them were small sample sizes. The Wisconsin study was 293 mothers. The second study on material hardship was about 1,100. But when you're looking at state-level fixed effects policies, the power we had to implement a more rigorous design was really limited because some of our states had too few of sample members to actually run more rigorous analysis. Oh, there it is. I'm sorry. My screen changed. And also we were limited by what was available in the data. Most had really good questions around leave in the survey sets that we were using, or not having good measures around state-level policies that we were trying to glean from other resources. So what do we still need to know? I think hopefully what you've taken away from this, because I think I've like beat it at horse, is that we patchwork in the U.S. And so we have little information, despite the patchworking that we do, in how mothers are packaging together different types of programs. So one example of that would be paid family leave states. California has temporary disability insurance. They have paid family leave. They also have means-tested cash welfare, and then a host of other means-tested programs that are important for moms with babies, like Medicaid and child care subsidies. We have very little information in the year prior to birth and then in the year post-birth, how mothers are using these different sets of resources that are available to them. And without that information, we're going to have a tough time coming up with a set of programs that might be optimal in supporting a poor single mother and her child to hopefully have impacts on long-term economic and health well-being for mom and baby. We have even less information on how moms are making decisions from the birth when it comes about barrier that was found in some California studies of their paid family leave program, particularly the trade-offs of participating in, especially in means-tested programs, because there's stigma involved in those programs. And then what we don't know is how families are making ends meet in that year post-birth. It's really important for different interventions around that first year of birth. Research that's come out of California, where the big takeaway was essentially that it wasn't as tough as opponents to paid family leave in California predicted. Employers tended to not report having too bad of a time implementing it. if this were something that were more widespread and it included more low-wage workers, you can imagine how some of those perspectives might be different, and we should try and understand that. Unintended consequences. There was a big article in the New York Times in the last couple of weeks that discussed some anecdotal evidence from states with paid family leave programs that there seemed to be women reporting that they thought they were less likely to get hired or were having their hours cut and not becoming full-time workers because employers were worried that they would eventually take up these programs designed to support maternity leave, namely in the public sector. And so from an empirical perspective, we need to have information on that to see if that pans out, because that should feed back into how we're designing our policies and perhaps employer rules. And as I mentioned before, we know some about child development and maternal and child health, about maternity leave in general, but we don't know as much for moms who are lower income and single and poor mothers and their children. And that arguably may be the most important group, because we know from longer-term studies on child outcomes that those are the most disadvantaged children when it comes to child development. So the challenges, data. I mentioned that a few different times, the challenges we have with our data. Limited quantitative data in terms of questions that are asked and that can be analyzed, and we have limited qualitative studies right now on knowledge and decision making around the time of a birth. And then a unique challenge we hadn't really thought about before we embarked on a lot of this work was that there are very few temporary disability insurance and paid family leave programs, and they're all clustered in the same states. Every paid family leave program has landed in a state that already has temporary disability insurance for a host of reasons I'm not going to talk about today. So we have very few of these programs. They tend to be clustered in a handful of states. And making this tougher is that what we want to try and understand is, how means-tested programs play into these other public support provisions. But the states that have TDI and paid family leave are also really generous welfare states. So we have very little variation across these states, across these three sectors of maternity leave support, which doesn't allow us to leverage those differences to test for significant differences by different programs. Okay, I think that wraps it up. Thank you so much for the time to present the research, and I'm happy to take questions.
Thank you very much. To those listening, please continue to ask questions in the Q&A box. If we don't get to them today, we'll ask Marcy to answer them subsequently. Also, we encourage you to join the conversation on Twitter using the SSRC webinar hashtag displayed on the screen. Tweets using this hashtag will display on the left side of the webinar platform. Now I want to turn to Dr. Margaret Sims, our discussant.
Thank you, Chris. I know that there are quite a few questions and we don't have so much time, so I'd like to just make a couple of points. I think first I'd like to go back to a point that Marcy made, which is about the nature of the Family and Medical Leave Act in terms of how it relates to people who may be in low-wage work. The pay is, there is no pay, it's unpaid leave, and so even if your employer is willing to let you take this leave, and it is discretionary if it's a small company as opposed to one with 50 or more employees, but you don't have any income. So even if you are able to access one of these programs, you're not really going to be very well off economically. And even in a low-wage job, you may be better off going back to work as quickly as you can. And so we need to think about what that implies if we're really concerned about some of the child welfare issues as well as material hardship. I think the other point I would like to make has to do with child care arrangements. Marcy alluded to the changing nature of work and the increased prevalence of non-standard hours or shifting work shifts, and this makes child care arrangements much more difficult, particularly for single mothers who may or may not have a co-residing father, because we don't necessarily know that, and I don't know if Marcy looked at that as she was looking at some of her data sets, but it may be much more difficult for these women to be able to find adequate daycare arrangements when they are not in the standard 9 to 5 jobs that most daycare centers operate in. So I think that as Marcy indicated toward the end, there are some things that we really can't know from these data sets, although there are some things we could learn. And Urban Institute in my Low-Income Working Families Project, we are looking at what kind of child care arrangements that these single mothers, many single mothers are making. And I don't want to scoop myself, but they do become more complicated as they have non-standard hours. And I think I'll just now, I see some very interesting questions coming up, so I'll pass it back to Chris.
Thank you, Margaret. Actually, one of the questions that has come in builds on what you're saying. You were asked, what other programs did these moms take advantage of? Marcy?
Yeah, so we had limited time in what I could present, and in the study that I presented today on material hardship, the first question we had is, what's the take-up of TANF or cash welfare in the year after a birth? Because we really didn't have a good sense of that. Like, what share of low-income mothers are actually using TANF in the period after birth? And it turns out, from our data on SIP, we see immediately post-birth about 26%. And if you look at it the year following birth, it's almost 30%. That are reporting using the TANF system. Now, in our other studies, we were trying to measure the state effects, state policy effects. So we weren't measuring whether moms were using those programs. We were measuring whether the level of generosity in a state impacted the outcomes we were looking at. And I will say, I have a doctoral student, Alex Stanzik, and then I'm doing some work with Heather Hill, where the three of us in different types of studies, but looking at very similar questions, are looking at, in the year prior to and post-birth, what do packages of means-tested support specifically look at in the year before and after a birth? I don't have any answers for you today, but I can tell you that it's clearly a research interest in trying to understand that.
Okay, thank you. Another question is, do any of the three paid family leave states preclude receiving both paid family leave and means-tested benefits? And I assume they mean not just TANF, but other means-tested programs.
So it depends on, my understanding is that whether or not you end up going over the income limit. So if you could remember from the slide where it showed the different states and what their caps were, California's was very high. It was like $850 a week. So that family, times 4 is about $3,200 a month. They would clearly go over the income limit for TANF. But I think the reality is that if you're a low-wage working mother living in a state with paid family leave and TANF, because the wage replacement is only 55 or 66% depending on what state you're in, that the likelihood of you kind of earning your way out of TANF for most is probably going to be pretty low. So in theory, families in those states should be able to package those things together. That's also another area that I think is ripe for study, especially in the emerging paid family leave states, is are they doing that? How are they doing that? Do they know they can do that? And does it have a positive impact on economic and family well-being outcomes?
Okay, great. But can you say in about 45 seconds something about what the policies and benefits in other countries are? What are they doing?
Yeah, so I mean, you think about like Scandinavian countries, Germany, Europe. All industrialized nations have some form of paid maternity leave, and actually paid paternity leave is becoming more and more popular. The U.S. programs on paid family leave, the table showed it was about 5 or 6 weeks, depending on the state. Other industrialized nations, by and large, are beyond that. I think the shortest period of time might be about 14 weeks. These are also countries that typically have not just, these kind of single system programs for paid leave for moms and dads, but they also have really generous other social programs like universal child care or universal pre-K that fit into what, the point that was raised about childcare makes a huge difference in your ability to return to work. So they don't look just better in outcomes because they have paid leave. They oftentimes look better in outcomes because they have these periphery programs that also support work among parents with young children.
That's great. Thank you so much for presenting today, and thank you, Margaret Sims, for being discussant, and to our audience. Marcy's papers are on the Self-Sufficiency Research Clearinghouse website, and we will be posting this webinar and responses to these questions and others as soon as possible. Thank you all. Have a great day.
Great. Thank you so much.